Excellent, thank you. Well, thank you for having us. My name is Dr. Razi. I'm the Chief Medical Officer for AccuKardia, which is a health tech startup based out of New York. I practice in the United Kingdom, and AccuKardia is a new tech company based on ECG analysis. I guess we take it back a step. We're in an age of big data. So as a physician, I can look at an ECG in a few seconds and got a diagnosis. I don't need a load of platform. But if you change that data into the abundance of things coming in, so if you got a 1 week monitoring data, or you got patients with wearable technologies, you got athletes who are having biovests, and we've got more and more data. So you're getting 2 weeks of data, you're getting a month of data. Suddenly that one ECG becomes impractical. So you could farm that data out, and at the moment you've got analysts doing Holter monitoring and reading data. What our product can do is an ECG platform that ingests the data and produces meaningful clinical analysis and output. So you get descriptive data about what the ECG, what the components are, so the intervals, the rhythm, the rates. You also get diagnostic data, so we can diagnose 18 rhythms and different breakdowns. So you get that clinical output, and you get compression of a whole load of data within a shorter time frame and make it clinically useful. So that's where we come in, I think. Well, it enables analysis of a load of data. Yeah, that was good.
Tell us how it makes life easier for the patient.
Yeah, sure. So for the patient, it's that throughput time. So it takes a long time to read potentially weeks of ECG data. That could be compressed. So directly for the patient, you're getting an increased turnover time of results. You're getting the ability to analyze, not just from the doctor's office. So some of our other products incorporate wearable technology, so we can take readings from an Apple Watch. We can take readings from any device, essentially, because we're device agnostic. So we can build a plug-in to anything that can feed us ECG data. So that ability to take data is now getting out of the clinician's office into real world, into the patient's homes, into wherever you can get the data. Yeah, so data from anywhere, data out of the office. Gaps in science. So science is always evolving, and there's lots of people in the field. Science will come. So I guess that's a broad question. So I don't want to speak for other people and what they're doing. I think the guidelines are moving in the direction that more and more of this remote patient monitoring is coming from out of the office. So the trend and the movement is getting away from conventional fixed site office care. So the guidelines are following. The AHA is actually probably more advanced in Europe in that, where I'm coming from. So we're seeing it's progressive. Yeah, I think the AHA position on this and the excitement from here, the talking about it, is much more than we're seeing in the European meeting at the moment. So AccuKardia did a study with sunny downstate in New York, where we recruited 50 patients, so healthy patients, across a bunch of different spectrums of society, so multicultural input, 50 healthy patients, and they had an ECG from a regular conventional sit-down ECG or lying down ECG, and they had 30 seconds of Apple Watch ECG through our AccuBeat platform, which analyzes the output. So what we did from there, we compared the QT intervals from the regular ECG to the AccuBeat QT interval derived from the Apple Watch read. And we had a 95% confidence interval within which the patients fell. So our bland Altmans for that, our diagnostic matching was high. So 96% of patients were within 95% confidence interval for matching that. There was only a 10 millisecond difference from our QT platform read to the physician read on the ECG. So it was a good, healthy patient study. It was good for validating QT for our product, as well as heart rate and rhythm diagnosis, even though it was normals. So from there, we're going to build on more future research aims. So we want to extend our QT program into a disease population, so cardiac diseases, as well as a drug population where this really comes in. So the aim there is for future ability to remote patient monitor, again, taking it out of the office into the patient's homes, but bringing the clinical validation. So that is our next goal in our AccuKardia portfolio.